My name is Steve Buechler, and I've been asked to speak a bit on why bringing awareness to AML is important to me. And logically enough, my answer comes out of my own experience, which occurred in 2016. I was scheduled to go in for a routine physical, but I had no symptoms. I was feeling perfectly fine. I was really tempted to cancel it altogether. But for some reason at the last moment, I kept the appointment. And it turned out that some very simple routine lab work discovered that my white blood cell count was dangerously low. And my doctor reacted immediately. He referred me to a hematologist, and that hematologist said, we're going to do a bone marrow biopsy to really figure out what's going on. Well, what was going on, it turned out, was AML. I'll always remember my biopsy was on a Monday. I got the results on Wednesday. I was hospitalized on Thursday. I started chemo on Friday, and I met my oncologist on Saturday. That's how quickly it went. So based on that, one general recommendation is I think that there needs to be broader education about leukemia in general, and ideally about AML in particular. I had no understanding even of what leukemia was. If you'd asked me to define leukemia, as I found myself in a hospital hooked up to high intensity chemotherapy, I could barely articulate what it was. And as a result of that, all through my treatment, it was a very steep learning curve to figure out what was really going on. My doctors were excellent, but I was so far behind the curve in terms of understanding the process that I really would have benefited if I had known more about blood cancers in general, leukemia in particular, and AML specifically. A second thing that I think is really important is that you can have AML and not have any symptoms. And that's where the screening is really, really important. I mean, you can't have people getting screened all the time, but at the very least, regular annual screenings, maybe more often if you're older, to pick up diseases. I thought if you had cancer, you would know it. Well, I had it and I didn't know it until they had these test results. And even if you have symptoms, the symptoms tend to be non-specific. So you can have fatigue, you can have bruising, you can have night sweats. Those could be a million different kinds of things. And I'm not suggesting people get scared that they have AML every time they have those symptoms. But if you do have those symptoms, and they don't have an explanation, I think both doctors, regular general practitioners, community doctors, hematologists, certainly oncologists, and also patients, you need to push for a complete blood count at that point. That's a pretty good initial diagnostic tool. It's very simple to do. The results come back very quickly. And if your CBC counts are out of whack, that's a very serious indicator of something going on. And at that point, typically, they'll move you on to the bone marrow biopsy, which will confirm or rule out something as serious as acute myeloid leukemia. And finally, I think it's all the more important because of how fast this disease can spread. It's really the fast and furious of the blood cancers. I had one oncologist tell me that upon diagnosis, if you don't get treatment, life expectancy can be measured in as little as days or weeks, and months if you're lucky. And the longer you have it without knowing it, the worse your prognosis. So general awareness among the general population, recognizing you can have the disease without any symptoms, recognizing that even the symptoms are not very specific to AML. You need to get to that testing process as quickly as possible. The sooner you can do it, the better the prognosis and the better the hope for a good outcome. So that's what I would wish for people to do and be aware of, both patients and doctors.